In this video, I'm going to show you how to decompress your full back. And also, I'm going to show you what happens when you decompress your spine. Follow along in this video right to the end because this is how I'm going to do this video. I'm going to show you 3 exercises that show how to decompress your full back without using equipment. And after each individual exercise, I'm going to explain to you exactly what it's doing to the spine during that decompression exercise. Hi, I'm Dr. Walter Slubro. I'm a chiropractor in Vaughan, Ontario, Canada. At our office, we've helped many people with chronic spinal conditions improve their spinal alignment and get rid of pain associated with that condition without using surgery, applying corrective chiropractic methods. Why? Because I truly believe that an optimal spine means optimal health. It equals optimal health. And what we want for you is for you to live your life free of pain, doing the things that you want to do and enjoy in your life. And in this video, I'm going to break it down into different sections that shows you these 3 great full spine decompression exercises, and then actually explain what happens to the spine during each of those decompression exercises. Be sure to follow along, and if you're new to this channel, go ahead and subscribe below. And along the way, let me know what you think about the exercise, which one you're going to try first, and which one you find most beneficial. Comment below. Decompression exercise number 1 is for the neck, the cervical spine. So you need a place where you can support yourself. It could be on your bed, it could be on a sofa, some kind of a flat bench if you got one, a towel, and also a flat pillow or some kind of protection for your knees. So place the pillow on the ground. And what you're going to do in this exercise, keep the towel aside. We're going to distract the neck. So you lean on the bed or the sofa, something for you to lean on. Elbows on, grab the back part of your skull, the mastoid processes, hook them with your hands or the palm, with your thumbs or the palm of your hands. And what you're going to do is you're going to support yourself, bring yourself back, and you're going to pull towards the ceiling as you pull back with your bum, with your glutes. So hold here, and you're going to pull. So I'm pulling up as I'm pulling back with my bum. And if you look up as well as you do this, you get a nice distraction effect into my neck. Beautiful distraction effect into my neck. Grab a small little face towel, fold it up, put it behind the skull just like this, and again, same idea. Pull up to the ceiling as you distract back. It feels really good. You can hold that for 30 seconds. You can hold it for a minute, as long as you can, even 2 minutes. You can release that after 1 to 2 minutes and do it again. And you'll find some nice relief in the cervical neck, suboccipitals, and if you have any arm symptoms, possibly even in the arms. So in this first decompression technique, it's specifically for the neck, the cervical spine, which is over here. And there could be many reasons why that needs to be decompressed. Maybe there's a loss of alignment like that. Maybe there's a disc bulge or herniation in the neck. Maybe there's degeneration or loss of height of those discs, like thinning the discs. So when the neck is distracted, whether it's by your hand pulled up like a counter pull like you just saw, or using the towel to hook up here, what's happening is the actual spine is being distracted from here to here. So you're trying to separate those disc spaces and gap those joints and relieve the pressure. A lot of times the pressure happens because the head position sits on the spine, and if it's out of position or out of alignment, it causes abnormal weight and load in the spine. So when you apply a decompression technique, which separates the bottom part and top part, just like that, it's very, very helpful. Another thing that this decompression technique does is it actually helps to remove the pressure and the pinching on those nerves. When the spine is compressed, then you're decompressing it and you're stretching it up and down. So it's pulled, you're actually decompressing the pressure on those nerves as well. So it's very, very useful exercise, not just for local neck pain, but also for numbness and tingling to the fingers. Decompression exercise number 2 is for the middle back now. So we're moving down the spine to get that full back, full spine decompression series. What you're gonna need is a roll of toilet paper. You're probably wondering why you need a roll of toilet paper. We're gonna use it as a fulcrum point. Really good for any of that slouching posture to decompress and open up that mid back. So you're gonna lie down on the ground. It's gonna be better because it's firmer, so not your bed. Get this in that mid part of your thoracic area. That's the most hunched area. Make sure you have some space and gently lean back on it, just like that. And then that creates a fulcrum point to help extend your back if it's too flexed. Lean back to your comfort, drop your legs down, and then you're getting a nice decompression effect into that middle thoracic area, that mid back. If you want more of a stretch, bring your arms up behind like this. And it feels even more of a decompression effect in that thoracic mid back area. Very, very useful, very low tech. All you need is a roll of toilet paper to bend over. It feels great. Now in this exercise number 2, decompression technique for the mid back area, we're actually focusing on the middle area here. Now it's a great technique when someone has a hunching of the spine, just like this, that slouching posture. It's very common today. And when you're creating that fulcrum point where you're putting that toilet paper roll underneath, just like that, the spine is now unbending from that slouching position. Unbending from that slouching position. So in the slouching position, it's compressing the discs abnormally at the front, and it's irritating all the muscles on the back as well. It's causing advanced degenerative process over many years. More importantly, those discs get compressed. So when you bend it over a roll, just like that, you're actually stretching out the spine, causing a decompression on those discs from that bending effect of that hunch back. Very, very useful exercise to decompress that middle back area and reduce that slouching effect. Now this third decompression exercise to finish off the series in the full back decompression exercise is for the lower back, lumbar spine. We're gonna get some extension in the lumbar spine. You may have seen Mackenzie extension or extending the back in a prone position like a cobra position. We're gonna add a bit more resistance in there to get more distraction, more decompression. This is a bed sheet that's been folded about 5 inches. Now, what you're gonna do is you're gonna lie on your bed or on the ground for this. Place it behind your back, just like this. Get it to the extension position. So it's in the lower part of your spine. Hold it with your hands, and then you're gonna get into the extension position. Now this bed sheet is gonna create some resistance in there. So I'm gonna extend back even more. I get a nice decompression effect in that extension position, and I can pull back down towards the feet and forward towards my hands, pull forward with my hands, pull back, and really extend and decompress that lower lumbar spine to get a nice relieving effect in there. Great. Again, you can hold that for 30 seconds, for a minute, up to 2 minutes, or you can do some repetitions, like 10 seconds yes, on, 10 seconds off, and repeat that, whatever makes comfort for you and relief. Now this third decompression exercise is for the lower back, the lumbar spine, which is right down over here. The lumbar spine normally should be curvy. It should have an elliptical curve. When there's a loss of curve, that can be a trigger or a causation for disc injury and disc bulges. Disc injury can also be from degeneration or compression on those discs. So in this exercise where you had that bed sheet applied against the lower back, you're putting your spine into extension, which promotes that healthy curve in the lower back. So now the lumbar spine is extending. And then also what you're doing is you're pulling forward against the towel, right? And also you can also lean back a little bit with the glutes and pull back against the towel, and you get a nice extension in there, gapping those joints over here in the back and gapping the disc spaces and relieving the pressure and irritation, not just on the actual disc, but as well on the nerves that may be compressed because of that disc. It's a great decompression exercise, that extension motion with that little bit extra distraction to decompress the lower lumbar spine. Wasn't that interesting to see those exercises on how to decompress the full back at home and to see what it actually does on the spine? Those are great techniques that you can apply yourself at home. In the office, we do more advanced decompression techniques, but those are good things you can do. Now, one of the reasons why people may be looking for relief in their lower back and to decompress their lower back, which is the lumbar spine, is maybe because of an L4, L5 disc bulge or an L5S1 disc bulge and associated symptoms like back pain and leg pain. Well, I have this great video you can catch right here, right now. Go there right now. It's an exercise video for L4, L5 disc bulge. Shows 3 of my favorite and best exercises. Catch it right here, right now to continue the education process for you on this channel.